Hello everyone, I am Selin Karalı from Speech and Language Therapy English Department, and I am here today for you to give a lecture on Introduction to Speech and Language Therapy. If you want to reach out to me, here you can see my email address, which is selinkarali@biruni.edu.tr. And here is the content of my class. I will be talking about what is speech and language therapy, what is speech, what is language, and what are the communication models that we use to describe communication with people around each other. So I will be starting with speech and language therapy and speech and language therapist. When we say speech and language therapy, it is an important health discipline that is responsible for the management of children and adults with communication and swallowing disorders. And these individuals they take part in assessing, diagnosing, and treating these kinds of disorders. They are not limited to swallowing and communication disorders, but also voice disorders, fluency disorders, and other types of disorders that can affect speech and language, also communication, are also studied by this department. We also take part in advocacy and research, and also mentoring and supervising SLT students. It is important for us because we are like the pioneers for speech and language therapy related researches, and in order to be an efficient SLT, you need to be supervised and monitored through your education. I believe that it will be better to understand our department by using a case example. So I will start with a case that I brought you today. Mary is a 50-year-old primary school teacher, and she is married with 3 children. She has enjoyed good physical and mental health as an adult, and she drives 10 kilometers to her work each day. On her way to work, one day she is involved in a serious traffic accident. After that, she sustains a severe head injury as well as chest and abdominal injuries. After that, she was taken to the hospital, and CAT scans show that she has subdural hematoma in her brain, and to cure that, she has gone through some surgery, and after a while she had to stay in intensive care unit. When she is out of the intensive care unit, her neurologist referred her to a speech and language therapist. After the examination by speech and language therapist, she was assessed as alert and appears to be oriented to time and place. However, she was completely mute. She cannot make use of her gestures, and she cannot communicate by using her sounds. Also, a bedtime assessment reveals that comprehension of simple 4 and 5 word utterances were impaired. So she can't understand when you say her a complicated sentence, and she shows whether she understands or not by using her eye movements. So it was harder to communicate with the other personnel at the hospital, and also with the speech and language therapist. And also she is receiving non-oral feeding, which means that she had difficulty in swallowing and eating by herself. And she has that kinds of impairments as a result of her head injury, and it affects her communication and swallowing. We say it as she can't understand utterances beyond a certain level of linguistic complexity. We say that she has a language disorder. Also, when she wants to say something or utter a word or explain, when she wants to explain something, she can't use her speech apparatus. That means that she has also motor speech disorder, and that disorder prevents her from producing intelligible speech sounds. Also, she has swallowing disorder, which shows that she can't eat by her own. As we see in that example, what can an SLP do in that case? We assess and diagnose each of these disorders, whether she has a language impairment, whether she has a only speech impairment, she has swallowing difficulty or not. We need to take part in assessing and diagnosing these kinds of disorders. Also, we need to be there to undertake an appropriate course on intervention, because after the diagnosis we can't just leave the patient like that. We need to find a way to intervene and help the patients. Also, we can educate their family members, and as she has some difficulty with communication and swallowing, her family needs to know what they can do to help her. Also, we need to advise about adjustments that they can make at home to facilitate her communication with her family. Sometimes we need to teach some specific techniques to make their communication easier. We are not limited to just speech disorder, motor speech disorder, and language disorders. We can also work with other types of disorders that can affect communication. These can be seen here. For example, fluency disorders. When a person has a fluency disorder, they can either speak too much, which means they have a cluttering, or they can have some pauses or stops or blocks when they speak, and it can be named as stuttering. Sometimes a child can have difficulty in producing correct speech sounds. For example, they can't produce R sound. It can be named as speech sound disorder. Sometimes a child cannot learn language in time. It can be named as delayed language disorder. We can work with voice disordered people. For example, when a teacher has to speak so much and too loudly at the class environment, they can have vocal fold nodules, and we are there to help them. Also, there are other types of disorders that affect our communication. That can be cleft palate, aphasia, and other related neurological disorders. Like we talked when I was giving you example that case. And also, apraxia of speech can be seen as a speech and language disorder that we have to work with. And I've been talking about speech and language disorders, so we need to define each of these words to understand what we do better. For example, when I say speech is how we say sounds and words. When we try to define speech, we have to include three subtitles for them. For example, articulation, voice, and fluency are the important part of speech. When I say speech, it is how we use our vocal tract and how we use our vocal folds and how we use our vocal apparatus to produce a sound. And in order to make a speech sound, we need to use our mouth, lips, and tongue. For example, we need to be able to say R sound to be able to say rabbit. If we can't produce R sound, we can say something totally different, and it can be meaningless for the listener. Also, in order to make an intelligible speech, we need to have a clear voice, and in order to create a voice, we have to use our vocal folds and we use our breath to make that noise. Sometimes people can use their voice either too high or too low, and it can affect their speech. Sometimes if you talk too much without carrying your voice, it can cause voice problems also, and it's related to speech as well as our voice. And finally, there is fluency, and we can explain that as rhythm of our speech, and sometimes our fluency can be affected, so our speech is affected in that way. And if we continue, I want to explain you what is language. And when I say language, it refers to the words we use and how we use them to share ideas and get what we want. In order to know a certain language, we need to learn and we need to know how the words mean, and how they affect our daily life. For example, when I explain something related to star, if a listener doesn't know what the star means, they can't understand, and they can understand something totally else. So it can affect our communication. Language is a little bit abstract concept in that sense. And when you know a language, you know how to make new words. For example, in order to be able to say friend, friendly, unfriendly, or making new words, we need to know the rules that can make a new word in the specific language. For example, when we start to learn a new language, we are not that competent at that language, and we can't know how to make new words, or we can't know how to add suffixes, affixes, and other things that are added to words. Also, when we know a language, we know how to put words together to create a meaningful sentence. And as we continue learning a new language, it comes to us much more easily. And knowing a language is also knowing what to say in the specific contents or in different times. For example, we can't use the same language when we talk to our friends and when we are talking to our superiors. So it can depend on the context, and when you know language, you know how to use these differences between, you know how to use that language knowledge, in different environments. In that sense, I think it will be better to explain the elements of language, because when we say language, there are three elements that we need to know to understand the language better. These are form, content, and function. You can see from that diagram here. For example, when you know the function of language, it is easier for us to communicate with the people around us. When we say pragmatics, it is knowing what to say in a certain context. And when you have a difficulty or impairment related to pragmatics, you can have difficulty in finding the right words in a given context. Also, content is important when you think of language. In the content title, we can see here there is semantics. Semantics is related to the word knowledge in a given language. And when you learn a new language, or when you are getting competent in your own native language, you start to learn basic concepts, and as your semantic knowledge grows, it can grow as you go. So semantic is very important. You can think it like going away for a foreign country, and when you don't know the words, you can't comprehend anything around you. So semantic is related to that. And when we say form, it entails phonology, morphology, and syntax. These are the forms that creates our systematic language usage. For example, in phonology, we use sound strings to make up a word, and in the morphology, we add affixes, suffixes, and prefixes to make a word or change the meaning of a word. And in the syntax, we use that knowledge to create or to construct sentences. And as a speech and language therapist, we know all of these, and we know how can an impairment occurs when there is an impairment related to each of these form, content, and function. So it's really important distinction for us when we say speech and language. These are similar, related, but totally different to terminology in our department. I think it's good to make that distinction for our department. Also, I want to explain you communication models, because as we know speech and language, we need to use them to communicate with the people around us or communicate with each other. So there has been so many research on that, and there has been 3 models created for explaining how the communication occurs. And here you can see the transmission model, interaction model, and transaction model of communication. It starts from the basic transmission model, and it gets more sophisticated as the other communication components are added. I want to explain you here today the transaction model of communication, because it's the most sophisticated one, and it will be it contains much more elements than the other ones. So I think it's better to understand how the communication occurs. In order to make a communication, we need to have at least 2 communicators, because one person needs to have an idea or something in their mind to share with the other people or other person, and they need to exchange some meaning between them. And you can see here, first one is encoding, which means that they use their language capabilities to create a meaning, and after that that means that they are encoding the word, the language they know, to create a meaning. As for the other communicator, they need to decode what they are being told, and they co-create the meaning, and it can also be affected from different noises around them. It can be social context that the communication take part. It can affect their communication. Also, their physical and psychological context can affect their communication. For example, when you are in classroom, which is too cold, it can affect your communication. Or cultural context also can be effective disruption for communication, because in some cultures there are some differences that can affect how the communication goes. Also, relational context is important to how the communication occurs in a certain concept or context. So when we say communication is not a simple process, it can be affected by so many other environmental things, which we call them noise, and there are types of noises that we will talk about later. And as a result of my presentation here today, I want to summarize everything I have said so far. What we do as an SLT or speech and language therapist, we need to raise awareness, and we need to make everyone aware what we do related to speech and language therapy. We need to do counseling, which means that we have to explain people who have speech and language impairment. Also, we need to take part in making therapies. We don't finish when we don't stop when we finish our therapies. We just need to follow up what has been going through with the patients and their families as well. So our job is important for that matter. And That's all for today. Thank you for listening me. If you want to reach me, here you can see my email address, and if you want to reach me, you can send an email to me. Thank you.